Welcome to Candid Conversations with Dr. Kelly, where we dive deep into the conversations that matter most to your mind, body, and soul. I'm your host, Dr. Kelly Utenham, a passionate advocate for brain health and wellness. And here on this podcast, we explore candid conversations about life, health, and the stories that shape us. Whether it's about mental health, sports, or simply navigating everyday challenges, we keep it real, raw, and relevant. Without further ado, let's get into today's episode. Welcome to another episode of Candid Conversations with Dr. Kelly. I am very excited to be joined today by Justin Chipperfield. I am very excited to have another international call. Justin is coming in from Canada. Justin, thank you for being on the show today.
Thanks for having me.
So, will you please introduce yourself to our listeners? Justin is a physiotherapist in Canada. So, Justin, will you tell us a little bit about yourself?
Yeah, absolutely. Thanks, Kelly. I've been working as a physiotherapist for close to 27 years now. It's kind of hard to believe. And I have a special interest in working with people with orthopedic conditions, people of all ages, right from babies right up to older adults and seniors. I started out my career working in the public healthcare system here in Canada for about 15 years, and for the past 12 years, I started my own business, and that's been keeping me really busy, and I've been learning and growing a lot with that. And aside from that, I'm a proud father of three kids. I've got a son and two daughters, as well as a dog,
What's your dog's name?
Fergus.
Burgess. I think that's the coolest name.
Yeah, we love Fergus. He's a standard poodle. He's almost 12. He's turning 12 this week, actually. And yeah, he's just awesome.
Oh, well, we love dogs here. It sounds like you have a beautiful family. Is
Thank
anybody
you.
else in the physio space?
No, we have the two kids in university, both studying more in the arts realm, and my younger daughter's in grade 11. And so far, no potential physiotherapists in the family, as far as we can tell, unfortunately.
Oh, there may still be time.
Yeah, you never know. My
Yeah.
son worked with our company for about a year and a half, and it was great to work with him.
Well, keep it all in the family. I like that.
Yeah.
I would like to help our listeners out there. Can you tell us what a physiotherapist is?
Yeah, that's a great question. I feel like the best way to describe it is we have a lot of training in physiotherapy is actually quite a broad practice area. So I'll try and give you the shortest answer as I can that's most succinct. I feel like where we really excel is in connecting with people, like with our patients and with our clients, really taking the time to get to know them. We're really curious about obviously when we're working with people, usually they've had an injury or they are looking at preventing themselves from having an injury. So we really like to do a deep dive on getting a good subjective history on what's going on with them, what their interests are, what their goals are. And then I feel like really where we excel is in the area of human movement. So we really have a keen eye at analyzing how people move, like what normal movement patterns look like. And this is something obviously you learn over the years, and with more years of experience, get to know more what like normal movement looks like. And if someone has like mobility issues or pain or disturbed movement patterns, then we can really get to the bottom of how we can help correct that and help the person to move better and to feel better, to have less pain, and ultimately to increase their function and get them back to doing the things that they love doing. We really get a lot of training in human anatomy and physiology. So I think a lot of it comes down to just that thorough training that we get in university that allows us to determine and often figure out like what's going on with the person, explain it to them, lay out a treatment plan and a treatment program, and help them reach their goals and potential.
Wow, very intricate, but yes, you are correct. It sounds broad. Could you tell me, I've got so many questions. Could you tell me what kinds of patients you see? You were mentioning people who are injured. What kinds of injuries?
Yeah, it can be a real wide variety from an orthopedic point of view. I think of things like sports injuries are really common, even for like, recreational athletes, right up to competitive athletes to your weekend warrior. So a lot of could be like a shoulder injury, like a lot of muscle strains, ligament, muscle strains, ligament tears. Um, we often see people with that have had fractures, like broken bones, and we help them to rehabilitate after that. We often see people who have had surgery, like an orthopedic surgery, like an anterior cruciate ligament repair, for instance, and helping them rehab that from that post-operatively. And then it goes right all the way through to neurological conditions. So working with people that have experienced a stroke or have Parkinson's disease or multiple sclerosis or any sort of neurological condition. That's another sort of really specialized area of physiotherapy. And then we have cardiorespiratory physiotherapy. So, anyone that has like COPD or any sort of chronic lung conditions or cardiac problems. That's another area of specialty. And there's just so, like I said, it is so broad. There's, one of the real emerging areas is, I think, pelvic floor physiotherapy, like concussion therapy. And I'm starting to run out of
You're
conditions,
speaking
but
my language now. I heard
yeah.
concussion.
Yeah,
Um,
totally. There's really just such a wide variety of conditions that physiotherapists can work with.
yeah, that is wonderful. So, well, the way the brain works, we look to compare, something to help familiarize ourselves better. So it sounds like physiotherapy could be in the realm of physical therapy. Is it the same thing or slightly
Yes,
different?
no, it's the same thing, and it's really interesting because, in Canada it's interesting. Like when I graduated, and the school at UBC here is called physical therapy. But in the community and in practice in general in Canada, we tend to call it physiotherapy or physio for short. But I know my understanding is in the United States, it's more often referred to as physical therapy. Is that correct?
That is correct. Physical therapy, and if you're in the medical setting, really shortens it to PT.
Yes, PT. Yeah, that's another one. Not to
Yeah,
be confused with personal training, which sometimes gets into the mix too.
it can, but in that rehab space, PT always means physical therapy. But
Yeah.
okay, so there we go. For listeners, if you are familiar with physical therapy, physiotherapy is what it is called in Canada. And it sounds like you all have the same vast scope that PT has in the United States.
Yeah, I think that's one of the best and most exciting things about our profession is you can either be, a generalist working like say at a hospital as a casual physio where you float from ward to ward, working across, you could be working in the intensive care unit one day and on the orthopedic ward the next day, and then the next day on the medical ward. Or, in other areas of practice, especially private practice, you can really get niche, like when I started my business, I only was working with babies.
Well, yes, I'm glad that you brought that up. I am really wanting to hear about your time in business. You said 12 years now?
Yeah.
12 years. Congratulations. That is a feat. to be in a
Thank
business
you.
that long. Yes. And you have a very unique component to your business because you are mobile. Is that correct?
That's correct.
Yes. Can you talk about that?
Yeah, I when I started my business, I had worked at a private clinic as well and working at the hospital, and I just felt there was a real need for the mobile physio, in that, there were times when people would be, say, discharged from hospital to home, but they weren't well enough or ready enough to come back into the hospital for treatment or get to a clinic for treatment. And unfortunately, in Canada, sometimes with our public system, we have some long waiting lists. So people are just at home, not really knowing what to do. And for the most part, people tend to gravitate towards like err on the side of caution, meaning like, I don't know if I should move my body because I don't want to damage anything. So I really felt like there was a gap in our system, and I had had a couple other friends that had started out a couple years ahead of me doing mobile, and I just met with them and took them out for lunch and had a coffee with them and picked their brain, and decided that it would be a really nice business model as well, in the sense of it's a little bit more family friendly to start. When I started, I was like a very involved dad, like, part-time stay-at-home dad. And I would be able to, drop my kids off at school at just before 9, and I could pick them up at 3. So I would just see clients in between 9 and 3. And it had some really amazing flexibility in that sense. Whereas, in clinic settings and hospital settings, there tends to generally not be as much flexibility. It's not to say it can't happen. However, this was just a really good fit for where I was at in my life at the time. And I think it's also been a really, we've been able to really grow our team. And I think the biggest perk of working in mobile physio is the flexibility.
Absolutely. What does that look like? Is it a mobile truck or do you have multiple vehicles that you send people to people's homes in?
Yeah, that's a great question. Yeah, no, everyone just has their own vehicle, and we have a variety of shared equipment. Like we've got quite a few the portable massage tables, and portable modalities that we can use, and everyone has a little kit with some basic exercise equipment in it. And we just go out to people's homes for the most part. And we also see clients at care homes or sometimes at their place of work, sometimes at community centers. The nice thing about mobile is you get to be, in some instances, you get to be a little bit more creative with where you're having a session with the person. So, for instance, some of the most memorable sessions that I've had have been outdoors with people. Like, if someone, for instance, wants to get back to playing tennis or pickleball or the driving range, we can meet them there and, run through that activity with them and sort of help them get back into that activity that they love doing. So it's really unique that way.
I love that. I love functional therapy, things that the patient or client actually cares about. So when you're saying, meeting them at the pickleball court, those things really excite me because it's like they really want to engage and participate in those kinds of exercises, and you get beyond the rehab gym, right? I love
Yeah, and even just getting people outdoors. A lot of people who are really struggling with whatever they're going through, whether it's an injury or a neurological condition, are often shut in, and they're kind of stuck inside, and they don't have maybe the confidence to go outside and navigate stairs or sidewalks or curbs. So it's a great way to get people outside, which is obviously really good for anyone's mental health.
Mental health, yes, and the vitamins that you get from being in the sun and just the breeze and the visuals, yes. Being outside for sessions definitely boosts moods. I've done quite a few sessions and also quite a few co-treats, which leads me to ask, how often do physios work or collaborate with speech therapists or occupational therapists?
Yeah, definitely. We have an occupational therapist on our team, and such a valuable member of our team. We have collaborated with speech and language pathologists in the local area here. There are a few people that do mobile work, so we don't currently have a speech therapist on our team, but it's something that I would love to add in.
Absolutely. What do co-treats look like with the other disciplines for physios in Canada?
Yeah, that's a great question. With many of our clients, if they have really complex care needs, we'll often have to do a co-treat session where, it could be with the physio doing their part of the assessment, and then the OT doing their part of the assessment, and then the two therapists coming together and communicating with the client and with the family on what the treatment plan looks like, trying to help them to achieve their goals. So often with the occupational therapist in our team, we're looking at especially like seating, wheelchair seating for several of our clients as well. It could be like home safety modifications or equipment that will allow them to age in place more safely at home. And from the physiotherapist point of view, also looking at just more probably like gross motor skills, function, strength, balance, and the occupational therapist may be looking more at fine motor skills. And we also collaborate with kinesiologists and rehabilitation assistants on our team. So we have several kinesiologists and rehab assistants that work really closely with our physiotherapists. And
Okay.
sometimes you need two sets of hands with some clients just to be safe and share the load and make sure that not only the client is safe, but also the therapist's bodies are safe.
Absolutely. So I want listeners to understand the vast team that can be a part of rehabilitation, especially for concussion. So would you incorporate kinesiology with the rehab for concussion as well, and how?
Yeah, definitely. We have a multidisciplinary approach when it comes to our concussion team. So the physiotherapist is typically the one that's doing the intake and the primary assessment. And then from there, they can delegate which other services are going to suit the client's needs the best. So, whether that's kinesiology, occupational therapy, or clinical counseling, those are the primary services that we have right now for concussion. And it really just comes down to communication, collaboration. The gold standard for us would be to do a joint session, so there's a good handoff. Failing that would be like looking at phone call, shared treatment plan notes, and just really good communication with the client and or their family to ensure that they know why we're involving another team member, and sort of what their purpose would be. And with something like kinesiology, obviously it would be primarily like a movement based functional, doing any sort of move exercises that the physiotherapists can think of and prescribe, and helping them to carry out that treatment plan.
Okay.
Here's a quick break with a quick question. Have you joined my Patreon family yet? It's the best way to support the show and get even more of the real, unfiltered content you love. There are 3 tiers. The free tier has previews and short clips so you know what's coming up. The $2 tier gives you behind the scenes content, travel vlogs, and me getting real on some taboo topics. And the $5 tier gives you full bonus episodes of Candid Conversations with Dr. Kelly that you won't find anywhere else. We've already got hours of content waiting for you, and trust me, we have a lot of fun over there. So don't wait. Head over to Patreon and join us today. Okay, let's get back to the episode. So, can you explain what kinesiology is for our listeners?
Yeah, absolutely. I'll do my best. I mean, that was my first degree before physio, and it's a great degree. It's a great training program. I absolutely loved it. And, I think that kinesiology has really come a long way and has become a more and more important part of what we do and who we are. Really, I think their big focus is on, again, like human movement. So like I was describing at the beginning of the call, like physios are really great at analyzing human movement, normal and abnormal movement patterns. And I think kinesiologists also do a really good job of this. Obviously, they've got a broad profession in what they can do as well. Some kinesiologists tend to branch out into doing nutrition counseling. Some kinesiologists that I know of are really into like functional movement screening. And really, at the end of the day, there's a lot they can do. And I really feel like, from my experience, from what I know, and like the members on our team and myself, I work out with a kinesiologist as well, and it's really about focusing on your goals, whether that's gaining strength, gaining flexibility, improving mobility, getting back to riding your bike or walking or swimming or really anything to do with physical function. I feel like kinesiologists do a really nice job of that.
Okay, good. So, listeners, kinesiology, that is something for you to keep on your list if you are rehabbing. So, when I talk to people, a lot of times they will say like, well, the doctor gave me a prescription for physical therapy and or it could be medication, but they haven't heard of a speech therapist, so I don't know if they would hear about these other disciplines. And so I want to make sure that people know who to ask for, because as in my experience in communicating with people who have survived concussions, a lot of them will say, well, the doctor, didn't tell me that I was going to need to speak to X, Y, and Z professional, or that this was an option. So, we like people to be to take little gems and education away when they're listening. So thank you for that. Going around the total body, I'm very curious as to the vestibular work that can be done. Physical therapists in the United States, they can specialize and get training in vestibular work. Is it the same for physio in Canada?
Yeah, absolutely. I'd say that's it's definitely an area that I think is gaining some traction here in Canada. Like there's a few members of our team that have done vestibular courses, and it is a fairly niche practice, but especially with something like the area of like concussion, it's a huge tool to have in your tool bag, to have that knowledge and experience. And yeah, I think there's definitely more and more people, like more and more physiotherapists that I'm aware of that are getting trained in that area and taking courses and gaining experience.
Okay, that's good to know. I'm interested in well, this is the nerd in me. I would like to know about what the education looks like to get to be a physio in Canada.
Yeah, that's a great question. I think we have a fairly consistent system in Canada. It's interesting. I was just in Japan in Tokyo at our World Physiotherapy Congress meeting last week, and I discovered that there's really quite a bit of variety still around the world when it comes to physiotherapy or physical therapy training, but that's another conversation. In Canada, it's fairly consistent. It's a master's program, so you would do a bachelor's, whether that's, a bachelor's degree in any area really, and as long as you have your required prerequisites to apply to the program, it would involve like an essay, a reference, an interview, and then that it's a 2-year master's program. So the minimum amount of time that you could probably get it done would be 6 years.
With the 4-year bachelor's and the 2-year master's. Okay.
Yeah.
So to specialize in something like the vestibular space, what does that education look like?
Yeah, a lot of the specializations in physiotherapy tend to occur, after you graduate from university. So there's a lot of really great courses in Canada. Like they tend to be typically held at the bigger cities. I mean, I live in Vancouver, so we're a fairly large center, fairly large city. So there's often a lot of presenters that hold courses here. Certainly, you can find them at smaller cities in Canada as well, but there's a very robust post grad training program, especially in orthopedics. Um, Certainly, that's what I'm more aware of, but there's some great training programs for neurological conditions as well in Canada, and then from there, it really branches out into getting super specialized into vestibular, or you could take like a shoulder course or like a lumbar spine course, or you name it, like a knee course, an ankle course. Like there's no shortage of education here in Canada on these things.
Great. What is the what do you all call it? So in America, we refer to them as continuing education units and or CEUs in speech. Is there an
Yeah.
acronym in Canada?
Yeah, no, that's what we would refer to it as well. We don't
Okay.
have a formalized like system where you need a certain amount of credits each year. We definitely have like through our provincial registration, we have some annual self-review that we need to complete. But as far as like you need to have X number of CEUs, it's not a requirement. However, from my experience, with physio and physiotherapists, we're kind of nerds and love taking courses. It's just sort of ingrained in our DNA, I think.
I I've got to say the same for speeches. We are definitely nerds, but I know that there are speeches that will consume CEUs all year long. And then I know that there are speeches who, well, we do have a 3-year, every 3 years we're required to have at least 30 CEUs. And so some will wait a little close to the deadline, and then there's like a cramming session where you have to get all of them in. But
Yeah.
I do like that you get to pick the CEUs that interest you, so you get to specialize in. Yes.
Yeah, totally. No, we're lucky that way. And honestly, I don't know. I wouldn't personally have a problem at all if they brought in something more formal and structured. Again, I'm speaking in generalizations when I say that most physios love their courses.
I'm sure that there are some physios who would wait until the last moment if there were a standardized process put in place.
Yeah,
I'm interested about the PPCS or persistent post-concussive symptoms or syndrome. You and I were connected through a PPCS expert and survivor, Chandani Khan, a fellow Canadian.
that's right.
And I'm interested in that connection for physio because we talked about vestibular, that is in the concussion space. So how does physio work with someone who has PPCS?
Yeah, that's a good question, and probably one that's a little outside my comfort zone, to be honest. I don't personally have much experience or formal training in this area. I've, I've had a couple members of our team that have gone through it for sure, and my experience just in, you know, uh, chatting with them in the last 1 to 2 years is that it's very complex, and they often see multiple practitioners, and it takes time. And so it's definitely an area that we are a little bit more recently getting into with two of our physiotherapists now undergoing the complete concussion management program training. And so, yeah, you may be better off to, you'd probably get a better response from other physios on our team on this question.
Well, that's fine. I'm glad that your company has the professionals that can provide the services that are needed.
Yeah, for sure. No, we're always looking for ways that we can, help more people and serve more people in our community. And the concussion program is something that we're recently launched and we're really excited about. And it's really nice that we have several members of our team, including kinesiologists and clinical counselor that were willing to undergo the formal training program through the complete concussion management program. And so for us, that was really important to have that sort of consistency and that recognized um, platform as well, because they have a really robust like platform and app and charting program and everything. So it's really exciting for us to be getting into this space.
Well, of course, I'm very glad that you're getting into this space, but your surrounding area likely as well, because you all are well known for your love of hockey.
Oh, definitely. Yeah.
And
Yeah.
you play hockey as well, don't you?
I do. Yeah, I love ice hockey. It's probably like my favorite sport. I've been playing ice hockey since I was 5 years old.
Wow. So I would like to know if there are pieces of paper that have to be signed or education that's provided to hockey players or parents of hockey players about concussion and the risk and signs to look for. What kind of education do you all receive in Canada?
Yeah, it's a good question. I play obviously men's beer league, so there's none of that for us. We know where the AED is in the arena.
Okay.
However, my son grew up playing a lot of ice hockey as well, and on a fairly competitive level. And with my experience as a physiotherapist, I assistant coached for a number of years. But when he started to get into a more competitive level, they didn't want parent coaches. They had, paid coaches, and I still wanted to be involved in the team. So I signed up to be the safety person, they call it, kind of like the trainer. And part of doing that was going through a variety of training, including it's been a while, but around working, training around working with with children, obviously, sort of safety in that regard. But also, we had to undergo a concussion training program, and I really learned a lot about the return to learn and the return to play, and had firsthand experience with teenagers. Having concussions and helping them to recover from that and communicate with the parents as well. And so I think compared to, say, certainly even when my son was younger, say like when he started when he was 5, but when he was about 12, Hockey Canada really started to improve in this area. Certainly when I grew up playing hockey, there was none of that. It was just, we really didn't know any much of anything from what I remember, but now it's quite strict, and the team safety people, even if they're you don't have to have a medical background to be a safety person. A lot of just parents or just want to help out, and they take the training. So that's my brief experience working with concussions. But I think it's a really structured. There was definitely paperwork. There was communication with the physician, and that was certainly. I was really pleased to see that Hockey Canada has done a lot of work on improving that.
Well, it sounds like they are laying the groundwork, and other areas or other sports have some things to learn. Um, could you tell me what you meant by they're pretty strict?
Yeah, I mean, we definitely, we had to have a physician sign off for return to play. So there was a structured system in place in which we needed a doctor's note for the player to return. That's kind of what I was alluding to.
Okay. So, it sounds like it's taken very seriously. Has there been any kind of comment like it's just a concussion? I hear that a lot in America, where it's like, oh, I just have a concussion. Is it more serious than that, and how medical professionals or even, coaches, parents talk about it?
Yeah, that's a great question. I can relate to that with my brief experience around it. And again, it was brief only for a few years, but I think the biggest challenge was probably with some of the parents because these are teenage kids who are playing very high level hockey, and there was sometimes resistance there from the parents. They
I
wanted their, like kind of like, is this really necessary? Like my kid's fine. Let's get them back on the ice. So there was definitely a bit of navigating there.
I hear that with parents. It sounds like all over the place now. What advice would you give for navigating a sensitive situation like that?
Well, the nice thing is you can always just fall back on the structure that the structure that we're using. This is the way it's done. This is the way it is. And, I'm sorry, but you're going to have to talk to your physician. We're going to have to make sure we communicate with the coach, and really, just a lot of it is, I think, educating the parents as well on why we're being a bit stricter with it. And it's, due to the fact that it's in their best interest, as well as a variety of other reasons, especially with like recurrent concussions. And that is, yeah, I mean, it's just that's probably the best advice I could give, is just to have like calm, cool communication, and just saying it like, look, this isn't something that I came up with. This is Hockey Canada. Like, this is in the binder. Here, let's have a look at it. These are the forms. We're just following protocol. And I think, when I approached it from that angle, I never had any problems.
That's good. That's really good. So I'm hoping, I would like for it to be in legislation. Like, I want it to be part of the rules where parents, coaches, referees, that they're all educated, because it's important to recognize the signs, and a referee or a coach could absolutely recognize the signs of something if they were educated in them, which could save time and help young people's brains. So you have, your experience that you just talked about, and you play hockey, and you're a dad. So could you talk about some of the symptoms that you've seen in young people with concussion? Because I've spoken to parents, and, they can explain away, some of the symptoms that they're seeing, where it's like, oh, it's a moody teenager, or migraines run in our family. And so those things aren't ringing off as possible concussion, might need medical attention. Could you talk about some of the symptoms you've seen?
Yeah, for sure. I mean, again, it's been a while, but probably the most common ones would be like headache, nausea, ringing in the ears, sometimes visual disturbances. My son grew up playing goalie, and he had a concussion. Once he had we had we had a really good, top of the line goalie mask for him, but he got a slap shot. Like the shots are so hard nowadays with the new stick technology and everything, and he just got it kind of at the side of the head, like not straight on. And
I'm sorry,
so
for our
yeah, I
listeners,
mean,
a slap shot, what would have hit him in the side of the head?
the puck, yeah,
The
it's a
puck.
very
Oh,
hard rubber puck.
oh my
Probably
goodness.
traveling at about, between 80 and 100 miles an hour.
Oh my goodness.
Yeah.
Oh, I can't even imagine. Okay, please proceed.
Yeah, I mean, other symptoms could be dizziness, lack of focus, having trouble concentrating, low energy, like fatigue. Those are probably like the most common ones that I've seen.
Okay. I, of course, have, excuse me, heard and seen those things as well. Could you talk about what next steps would be if you were to notice those symptoms in your child?
Yeah, certainly, and I don't claim to be an expert in concussion. However, I think you really want to like monitor your child closely and just ensure that they're doing okay, that they're alert, and they can see, they can speak. Um, Sleep is a little trickier. That was always one that was, made me as a parent a little bit nervous. Like, do I need to go in and check on my kid every hour? Um, and I think those are probably like the biggest things just to keep an eye on. Are do they seem off? Are they having trouble sleeping? Are they sleeping too much? Like there's a variety of things. But again, certainly I don't claim to be an expert in this space.
Well, you're a parent, so you are an expert in knowing how to keep an eye out for your children. Some people, are not educated in that piece to even know to keep an eye out for it. So there's going to be somebody who hears this and gets something from it. So thank you for sharing that experience.
You're welcome.
I
Hey everyone, Dr. Kelly here. As the founder of Brain Talk Foundation, I'm on a mission to change the way our communities think about brain health. Every day, I speak to students, student athletes, parents, coaches, educators, and speech language pathologists, raising awareness about concussions, traumatic brain injuries, and the silent epidemic affecting far too many lives. With your support, Brain Talk Foundation can continue showing up where it matters most in the schools, on the field, and in the community, educating, empowering, and advocating for safer futures. Your donation, no matter the amount, helps us deliver workshops, create life-saving resources, and spark important conversations that lead to real change. And because Brain Talk Foundation is a 501c3 nonprofit, every donation is 100% tax deductible. So whether it's $5 or $500, every bit counts. Help us continue the work. Visit braintalkfoundation.org to make your donation today. Together, we can make brain health a priority for everyone.
So with physiotherapy, would you say that early intervention is best? Because you talked about people being stagnant, and I'm not sure if I should be moving around. I know in concussion, it used to be just stay in the dark and don't do anything for days and days, and then you'll be okay. And now, studies are saying 24, 48 hours rest, and then you should really be, starting to get moving and grooving with cognition and movement. What do you think about that?
Yeah, definitely. I was speaking with another member of our team who underwent the concussion training program recently, and that's exactly what he says is, uh, there's a big push and movement to get people moving sooner than in probably even, I don't know, however many years ago. I'm not sure when that shift occurred, but certainly from my understanding is that, yeah, like you said, you want to kind of maybe take that 24, 48 hours and then it's better to get moving.
Get up and moving. You
Yeah.
hear it with surgery, and then, it makes sense that, your brain too would need to get up and moving, those kinds of things.
Yeah, that's a good analogy, like when people undergo surgery, we want to get them up on the day of their surgery, right? Like we can see that the outcomes for recovery are much better either on like the day of the surgery or day one post-op. And so, yeah, I think what's your experience with this, Dr. Kelly? Like I'm really curious to hear what your take is on early movement post-concussion.
For cognition,
Just in general, like, for yeah, cognition and just, getting moving. What's your experience with that?
I agree with the earlier movement. Yes, I say rest because in that time of rest and sleep, that's when your brain, the neuroplasticity gets to kick in and start doing its thing. But for you to actually stimulate and exercise the brain in a responsible way, which is why it's important to have a speech therapist to be a part of that, because we break down every part of your day. We find out, what could be triggering headaches or triggering certain symptoms. We develop compensatory strategies to help with what you could be experiencing. But the longer that takes to get put in place, the person could be exacerbating their symptoms because I've spoken to people who are in the PPCS realm of time. So for listeners, if you are diagnosed with a concussion, depending upon your age, you're going to be given a range of when you're going to when you should be feeling back to yourself. For young people, it's 10 to 14 days. Excuse me. For adults, it's 10 to 14 days. For young people, it's 2 to 4 weeks. But if you are still experiencing symptoms outside of that, then you're in that persistent post-concussive symptom space. And so with that, you could be doing things that are causing you to have worse symptoms than you would if you had been working with a speech therapist. So finding out, what your triggers are and having a professional to guide you through that sooner rather than later, I think can really help with keeping those symptoms low and helping with a faster recovery. So yes, I completely agree with that. Great question.
Oh, yeah, that's some great insights. Thank you. And I think
Yes.
the thing for me too, I know when we first met a little while back is that really comes up for me is just the importance of having the speech therapist on the as a member of the multidisciplinary team.
Absolutely. And the speech therapists, we think about things that the client absolutely would not. I think about this client that I've worked with who is, she took time off of work and she said, I've really just been taking it easy. I haven't done much. And when I said, tell me about a day in the life, and that's how I prompt clients to, okay, start from the beginning. You wake up in the morning and then what? And she ran me through the most cognitively grueling day that someone with a concussion who's supposed to be recovering could possibly have, from getting startled awake from an alarm to making breakfast for her children and driving them to multiple locations because her children went to different schools, having friends over to visit, television time, movie time, picking the children up, making dinner, like just all of these things and a lot of television time. And then at the end of the day, she's like, I don't know why I have this headache. But to a very high
Right.
performing person who's like, well, she's not working. She's only caring for her children. And, that can be a lot anyways. She's thinking, man, like I'm not doing much. Why is it so debilitating, this headache? So speech therapy gets to get in there and really help with strategies and identify what could be causing symptoms to get worse.
I love that. It almost sounds like just from from what you're explaining as well, like this is something that, an occupational therapist tends to be quite good at and often like, really does a thorough job of. Is there some, would you agree? Like, is there some crossovers there from your experience with OTs on the team?
There's crossover with some of the things with OT. We do collaborate and co-treat with occupational therapy quite a bit, especially for things like ADLs. Speech therapy, we focus in on like an entire session could be specifically on cognition, focusing on memory or problem solving, depending upon the severity of the concussion. It could be that someone, actually, I was listening to Chinandi's episode yesterday. It'll be premiering soon, but she was talking about how just making a sandwich was very challenging, where she's just thinking about the ingredients and how you put them together. So speech therapy, we deal with the sequencing of that and the problem solving of that and walking through steps and strategies to help that piece of her life to get easier and for her to become independent of so she doesn't need therapy indefinitely for it, but working on building, regaining those skills back. But of course, that can incorporate occupational therapy in many ways.
Interesting. Yeah,
Mhm.
thanks.
Yes, very passionate about this. Obviously, I love what I do. I could talk
Yeah,
about
no,
it
I can
forever.
tell. No, that's
Thank
great.
you.
Yeah.
Um, well, I want to get to the Candid questionnaire, but I really would like for listeners to know how they can connect with you and how they can find more about Chipperfield Mobile Physio and Wellness.
Yeah, thanks. The best way to learn more about us is probably through our website, and you can find that at www.chipperfieldphysio.ca. Always happy to connect and collaborate with individuals, so feel free to reach out to me by email. My email is justin@chipperfieldphysio.ca. And check us out on social. Like we have a really active and fun Instagram account. And yeah,
What's the Instagram account?
at Chipperfield Physio.
Okay, so make sure that you check him out, go and follow. You'll be able to, we're going to collaborate so people can find you when we post about the this episode as well. So,
Excellent.
yes, and we'll make sure it's in the show notes as well so everybody can find you. All right, are
Thank
you
you.
ready for the Candid questionnaire?
I'm ready.
Okay, first question. What's one word your friends would use to describe you?
Ooh, good question. Let's go with kind.
Kind. I like that. You do have a very kind spirit about you and a very calming presence, if I might say.
Thank you.
You're welcome. Okay, number two. If you could instantly master any sport or physical skill, what would it be and why?
Uh, I would I love golf and I just it's a very challenging sport, but if I could do anything really, really well and like master it, it would be golf.
Well, I might have to join you there. I just got back into golf after a golf injury, actually. And
Oh yeah?
yes. So yeah, I can absolutely say that. Got to be able to keep your cool because sometimes you just I call it chasing the tink, like that perfect sound, when the club hits the ball.
Oh yeah. Yeah,
Yes,
that's what keeps us coming back for more, right? Yeah.
exactly.
Yeah.
Addicting, but I love it. I do love
It's
it.
yeah.
Okay, number three. What's one activity or hobby you find most relaxing or beneficial for your brain?
Definitely cycling. I love cycling, whether it's, road cycling or gravel biking. Yeah, I just find that it's really good. It gives, really good for my cardiovascular and aerobic fitness, good for my strength. And the thing I love about it the most is probably just being outdoors and taking in, we live in Vancouver. It's a beautiful city. I was just out for a ride actually before our call and almost lost track of time. So yeah, I was out for a ride just around Stanley Park here. For those of you who have been to Vancouver, Stanley Park is just beautiful. And yeah, just beautiful nature and exercise and outdoors and definitely if I can get a good bike ride in here and there, I'm very happy and relaxed.
I love it. That sounds lovely. I love being in nature. I'm actually trying to ride my bicycle more, and I'm actually participating in like group bike rides of like maybe 6 people and riding throughout the city. I find that like mountain biking is a bit too rough for me. I just
Yeah.
prefer smooth terrain and enjoying the scenery.
Nice. Well, good for you. That's fantastic.
Yeah, cycling is good. And like you said,
It
it's
sounds
also very healthy.
sounds like we have some commonalities there. Golf and
Yes.
cycling. Yeah,
Yes, and the
love it.
ice because I did ice skating. I wanted to do hockey,
Mm.
but I think my parents were scared. They didn't want me to get into hockey.
Yeah, yeah, I've definitely heard that for sure.
Yes. Now it sounds like, I was supposed to get involved with hockey in a different way, raising awareness. Okay,
Yeah,
let's
there you
see.
go.
Yes. All right, number 4. What's the weirdest or most unexpected item in your bag or car right now?
Hmm. It's a good question. I just cleaned out my backpack and I just had my car detailed, so they're pretty boring in there. Boy, I don't
Anything
know,
during the
really.
clean
Like,
out that would be
uh,
unexpected?
yeah, 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 definitely. Yeah, there was some I got some stuff on my desk here, like a really old granola bar and some um let's see, we got some sanitizing wipes from a flight that I was on about a year ago and yeah, there's all kinds of stuff down in the bottom of my backpack. I didn't have the foresight to clean it out before my trip, but in my car's I like to keep a really clean and tidy car, so there's probably some granola bars or we call them like road snacks rotting in the bottom of my center console.
Oh no, not rotting. But sounds like we have that too in similarity. I keep a very pristine car. There's nothing in
Yeah,
there.
yeah. Yeah, I could check that center console maybe. 'Cause the kids are always like, "Dad, do you have any snacks?" And so but we've been having like some it's usually fine in the winter, but when we're having like some much warmer weather, so things get a little baked in there. I should probably investigate.
Yes, because you probably have like a granola scent then in the car if it's
Yeah,
if it's
exactly.
being baked.
Yeah.
Well, I'm
Um
always for the lovely weather, so
oh yeah. Yeah, love it.
yes. Yes, even if it, means a baked oat smell or whatever kind of bars those are. They have a lot of
Yeah.
granola and oat, right? The
Yeah,
healthy
definitely.
snacks.
We're going with mainly the granolas and oats. There's probably some chocolate in there, which is something that could melt. I just thought of one other thing that was in my bag that, is a little bit random, but it is one of our main tools that physiotherapists use, and that's a goniometer. That's kind of
Ooh, tell
a
listeners
tool
what
of the
that is.
trade. Yeah, it's a device that measures angles, like joint angles. So, range of motion, if we're looking at like shoulder range of motion or elbow or knee or really any joint in the body, the goniometer is our tool of choice. So, yeah, that one
There
might be
you go.
a little bit unique.
Yes, there you go. Goniometer. Okay, last question. What is your go-to guilty pleasure TV show, movie, or song?
Definitely go song. I really I mean I love TV shows and movies. Absolutely. Love to follow various series along, but music is something that I feel like I just I must have every day. Spotify, again, just getting outside for a walk, uh, listening to songs on Spotify, like my like songs or New Music Weekly. Even like in the shower, I've got like a portable speaker up in our bathroom, and I love blasting music in the shower in the morning. And so music is definitely the one thing that I probably could not live without out of the three.
I love that. Well, I don't know if you know, but I am such a music and dancing person. I have to start my mornings with blasting music and dancing while you're getting ready. It just
Love
really
it.
uplifts the day. You got to start the day right with some movement and some music.
Yeah, yeah, it just gets you into the flow of things, you know. Honestly, like it's a big part of my daily routine, my morning routine, and yeah, I've always been a huge music fan.
Well, I love that we have so much in common, and I love that you took the time to share and educate our listeners about physiotherapy. So, thank you so much, Justin. We'll make sure that people can find you in the show notes. And just thank you so much for your time.
Yeah, absolute pleasure, Dr. Kelly. Thank you very much for having me on the podcast.
I'm sure that we will talk and collaborate and talk in the future. So, we will talk soon.
I look forward to that. Thank you.
Thank you so much for tuning in to this episode of Candid Conversations with Dr. Kelly. I appreciate you being part of this journey and these powerful conversations around brain health and beyond. If you're loving the podcast and want even more bonus episodes, exclusive Q&As, stories from my professional and personal life, behind the scenes moments, and yes, those bloopers you all love, then I invite you to join my Patreon family, where we always keep it candid. Your membership gives you access to all that bonus content and helps keep this podcast going strong. Plus, every contribution helps support our mission to raise awareness, educate, and empower others about the silent struggles so many face. So head on over to patreon.com/Dr. Kelly to join today. I'd love to have you. Until next time, stay curious, stay compassionate, and as always, keep it candid.